The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, Kiko Auctions, and, of course, our technical producer, J.D. DeAngelis, who refused to be in the picture this morning, but he's here. In the studio with me is Brad White, a compounding pharmacist.
Okay, a lot is happening in the world of pharmacy, from local store closings to news about middlemen called pharmacy benefit managers. I was trying to think up of a creative moniker for PBM, but I couldn't think of one that was airworthy today. PBMs are causing havoc on patient prescription costs. So today we're going to talk about these issues as well as medication recalls, flu and strep testing, monthly health screenings, along with how to interpret your numbers and more. We'd like to remind our listeners today that our program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, anywhere. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Brad, why don't we start the show by talking about medication recalls. What type of medications have been recalled, and how do we find out more?
Okay, well, recently, probably the most aware recall we've had is there was a blood pressure medication called Valsartan that was recalled for safety reasons. It wasn't so much because the medication itself wasn't working or was a problem. It was because the medication could have been exposed to a carcinogenic agent, and as a precaution, they were recalling it to make sure no one got exposed. As far as I'm aware, no one was hurt, no one was exposed, but it was one of those things where their quality control process decided that the best course of action was to be proactive and to recall all of the active ingredient to ensure that nothing happened to any patients. There's three types of recalls in the United States, Class 1 and Class 2 and Class 3. And the FDA grades them based on their severity and basically risk of harm to patients. So Class 1, there is a dangerous or defective product that could cause serious health problems or death to a patient. Examples include food board, botulinum toxin contaminants. Think of all the lettuce problems that we've had in this country in the last year. Undeclared allergens or label mix-up on a life-saving drug. There's a lot of quality control processes in place, but unfortunately sometimes things happen, and when they do that are this serious, that's a Class 1 recall. A Class 2 recall might cause a temporary health problem or pose only a slight threat of a serious nature. For example, maybe the drug is supposed to be 100 milligrams, but the batch that was prepared might only be 95 milligrams. So it might be subpotent. It is one example, okay? So it's not life-threatening, but it could affect a health outcome. And Class 3 is one that is the least severe. Products that are unlikely to cause any adverse health reactions, but they can violate FDA labeling or manufacturing laws. So an example might be a minor container defect or a labeling that is not in spec, if you will. So the product could be fine, but maybe they didn't have all the details on the label that they should have had. So that's a couple examples. If you have a medication that you're taking and you hear there's a recall on the news or on the FDA website or even from your pharmacy, the first thing I would do as a patient is I would talk to my pharmacist if it's a prescription medication, and I would ask them if the product that I have is of concern. There was a large portion of patients that we serviced during the Valsartan recall that did not have affected product. And so don't jump to conclusions, but get the facts. So talk to your pharmacist. You know, we recommend that if you don't already have a pharmacist, you have a personal relationship, we'd be happy to start one with you at the Medicine Center. But we can help guide you through that and let you know what the regulations and recommendations are for a prescription drug recall.
So one of the issues with this Valsartan was that the raw material for this drug was coming from, I believe, China or one of the foreign countries. And multiple manufacturers that were producing the marketable product bought their raw material from the same source. Thus, we ended up having 4 or 5 or maybe more manufacturers recalls by different manufacturers in this country of valsartan. And so this is what's sort of happening, is that a lot of the raw product, a lot of the raw materials for pharmaceuticals, and one of the things that came to light a year or so ago was aspirin, that there's no raw aspirin product made in America anymore. It's all brought in from other countries and manufactured in America. So we run into these situations all the time on a recall with many manufacturers as opposed to just one. Sometimes it is just one. So that's kind of how this whole thing gets into being a large amount of product, because that valsartan was down for quite a while, as I recall, until they were able to recoup enough product to manufacture enough replacement product. So interesting as it is, much of our merchandise, prescription drugs, food, all kinds of things are coming from other countries into our country. So.
Well, we want to take a second and thank all of the Ritzman Pharmacy patients that have joined our Medicine Center family. We've had a very large outpouring of patients that have come to our pharmacy, and we want to thank you for the respect that you have for our organization to give us your business. We want to be your partner in health. We want to help you with that. And one of the common questions we've gotten during this process is, how do I transfer my prescription? A lot of times patients go to a pharmacy and they, for lack of a better word, think they're stuck there. But if you have an experience where you're frustrated, or maybe the pharmacy you're working with can't help you get the service you need, all you have to do is bring your prescription bottle in or call us at the Medicine Center, and we can help you transfer your prescription. It's very easy. There are some legal ramifications on certain medications, but for the most part, it's as easy as a phone call, and we can take care of it for you. So don't be afraid to reach out to us at the Medicine Center Pharmacy. We're happy to be your partner in health, and we welcome everyone from the Ritzman family that has joined us so far.
A tragedy that is when an independent pharmacy closes, and they had multiple locations, I think 15 or 20, something like that, and they were all well run and that sort of thing. So what else can we do for these patients, these customers, besides help them in transfer, help them in transition, and make sure there's a consistent therapy with their prescription drugs?
There's a lot of fear from patients. We all like our level of normal, if you will. And one of the things that's been a common question was how do I transfer my prescription? So we talked about that. It's as easy as a phone call. The other thing is insurance. Do you take my insurance? And especially at the Medicine Center Pharmacy, we are a local independent pharmacy, which doesn't always get top billing on all the large insurance companies, but we take most insurance plans. There's very few we don't. So have confidence that if you have an insurance plan that you wonder if we're able to accept, give us a buzz. We can cover that for you and let you know. And but that's something that we can do for you. And that's a real easy thing. The other thing is access. Not every patient has access to a car or transportation or to be able to go out into the pharmacy community. We can come to you. We have home delivery at the Medicine Center. It's something that we can offer you as a service so that we can help meet your need if you have difficulty getting to your place of business to get supplies like vitamins and supplements or even your prescription. So we can do that for you and help you get there. Sometimes there's services that maybe the bigger box stores don't specialize in that we've been able to take care of. The most common thing is blood glucose monitoring supplies. If you are a patient or have a loved one that is a patient that has diabetes, we have a very low-cost blood glucose monitor called the Easy Max meter. We have this nice little kit that Jackie made up for us, our marketing representative. She put this together because one of the most difficult things that we deal with on a daily basis in the pharmacy is a patient that comes in and they're a newly diagnosed diabetic. It's a very scary thing. You're concerned because it affects a lot of different aspects of your life, from what you eat to how you take care of yourself. The worst thing you can do is walk into the pharmacy and find out your box of test strips cost $85 or the meter cost $135. So this kit we put together, The meter is free at no charge. You get a box of test strips free at no charge. A box of test strips on any given day for a box of 50 costs $7.99. That's not a typo. $7.99. So they are cost effective. It is a quality meter. We have thousands of patients that have been using this meter over the last 5 years with minimal concerns of quality. It has a gorgeous, nice, big display. It will talk to you if you need voice prompts, if you have visual issues or concerns. This meter is a class act. And so if you have issues with access to blood glucose monitoring supplies, come see us at the Medicine Center Pharmacy because we can help you. This is by far our most popular service that people have been asking about of late. We also have some other wound care supplies. We have compression stockings. We have some durable medical supplies. So there's things that we can do for you at the pharmacy that maybe the big box store won't. So don't be afraid to ask. You know, we like to tailor our service to what you need. So it's something that we can do, and we can often have access to things that can be custom ordered for you if you need them.
You know, a bonus going right now in our stores is buy one, get one free on all quality choice products. And that is a huge line of private label merchandise, and it's from vitamins to analgesics to feminine hygiene products, you know, all across the board. And we also have a couple of other vitamin lines that are set up at buy one, get one free. So don't be afraid to load up on your vitamin products and healthcare products right now, because the pricing is terrific, and we do have a horrible amount of it in our inventory, so we're going to continue the sale for quite a while. So what else do we have right now in our stores that is interesting, useful, and helpful to healthcare?
Well, a big thing right now has been vaccines. You know, we're coming, supposedly flu season's coming. We want to thank everyone who thought of the Medicine Center to get their flu vaccine there. We are still taking reservations for Shingrix or shingles vaccines, so that's an opportunity. If you are a new parent or a new grandparent, we have Tdap vaccines available. So that's something that's new. And there's some other things going on, too, that we can talk about after our commercial break that's coming up here. But I want you to stay tuned, because we have some things that we want to share that may affect you or one of your loved ones and could really make your medication management easier.
Okay, first break's here. You're listening to Brad White and Paul White on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit MedShopRx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about all things pharmacy, from medication refills to prescription cost increases caused by pharmacy benefit managers. Have a question? Post it on our live Facebook feed or call us at 330-450-1480. So, we missed a few things on benefits of transferring to the Medicine Center Pharmacy. What do we have left?
Very common question we've had lately is a loved one coming in the pharmacy that's concerned about someone in their family who maybe have difficulty managing their medications. And as someone who just takes a couple vitamins, I can appreciate how when you get more than 2 or 3 medications that you have to take at different times of the day, it can be kind of challenging. Our most popular service at the moment is our compliance packaging. And we have these great strip packs that we can customize your prescription packaging into individual packets. So you can have your morning medicine, your lunchtime medicine, and your afternoon medicine or evening medicine. These are really slick. We can pack multiple pills or capsules into an individual packet. You can tear these off and take them with you. So if you're on the run and you got to go to work, no sweat, you can just take this packet with you for the day. You don't have to take all your bottles and worry about them, leaving them in your purse or whatnot. So it's very portable. It's convenient. They're all labeled. They've got the name of the drug and when to take them and your name on them. So it's something that we can customize for you. It can be prescriptions. It can be vitamins. But it's something that can give you peace of mind, because if you can't remember if you took your 8 o'clock dose this morning, if your packet's still there with pills in it, you know you missed it. So it's a very convenient way to manage your medication. And don't be afraid to ask us about how it can help you. We have patients from assisted living facilities to executives who travel with these. So it can be for a variety of types of patients.
What about the various vaccinations? You mentioned that once already, such as the flu shots and the pneumonia and all those sort of things. And we're still giving flu shots, right?
We have some flu shots. We haven't been given a lot, to be honest. As far as I'm aware, based on earlier in the week's data from the health departments across the country, there is a little bit of flu floating around in different parts of the country, but in our area, there's not a lot yet. So if you didn't get your shot, give us a buzz or come in and we can get you vaccinated. It does take about 2 weeks to build up the antibodies in your system. So if you haven't done it, you really need to do it soon and immediately. But yeah, I failed to mention pneumonia. There's 2 pneumonia vaccines right now. There is Pneumovax 23 and Prevnar. The CDC and FDA recommend that you get both of them. They cover a variety of different strains of pneumonia bacteria or pneumonia that can cause infection. So, don't be afraid to talk to us, talk to your pharmacist, find out what you need. Patients with different medical conditions could have different needs for vaccines or be at higher risk and benefit from a vaccine. So don't forget to talk to your pharmacist about what's right for your situation.
So the pneumonia vaccines, you get 2 injections at 6 months apart. Is that correct?
No, actually, you get them a year apart.
Okay.
So you've got Prevnar 13 and Pneumovax, and they recommend you get them. They generally recommend you get a year apart, but they cover, the Pneumovax 23 covers 23 strains, the Prevnar 13 covers 13, there's some overlap in coverage, so you get a nice broad coverage with both those vaccines.
So there's actually 3 injections for pneumonia. Am I correct?
No.
1 and 2. No?
There's 2 pneumonia, but there's with the new Shingrix is probably what you're thinking of. For shingles,
sure.
Shingles has 2 vaccines, and so for Shingrix you get 1, and then sometime between months 2 and 6 you need to get your second dose.
Shingrix is still in tight supply. Is that
It has been
accurate?
in high demand.
Yeah.
And yes, we currently have a waiting list in the pharmacies. We're not real happy about it. We wish we could vaccinate everyone who wants it right away, but there has been such an outpouring for that vaccine because of its higher effectiveness and duration of length that people have preferred that one, and physicians and the CDC have been recommending that one over the other one in the market, Zostavax. If you need a shingles vaccine and you're at high risk, you could consider getting Zostavax now and then getting Shingrix when it becomes available. So that's something you could do later down the road, and they still give you some protection.
And individuals who don't really understand it, the shingles issue, it can be very, very debilitating if you get shingles. So these injections, I think that Zostavax was 10% effective, or do I have a...
It was more like 60, 65%.
Okay.
But the Shingrix, they're on the high 85, 90% effectiveness, and it's longer duration. So whereas in the beginning, when Zostavax came out, we were told the duration would be, it would be the only time you need it. Well, then as research got done, they decided that its effectiveness was probably only 6 or 8 years, roughly, depending on you, the patient, and how your body responds. But the Shingrix has a much longer duration of action and a much higher probability that it's going to prevent you from getting shingles.
So in the news right now is not necessarily an epidemic, but in the state of Washington is a fair amount of measles. What's going on there?
Well,
failure to have the proper vaccine, or is it coming this way?
One of the things about measles, I don't have a lot of answers since it's not active in our community, but I can tell you that the belief is that there is a movement of parents that feel their children should not be vaccinated.
Right.
There's been a lot of conflicting data in the past about the risks of autism with vaccinations. For the most part, the data seems to produce that autism is not caused by vaccination. So you really need to have a serious discussion with your healthcare provider about vaccinations, and before you decide that you do not want to vaccinate your child, you need to think about the long-term risks. There's diseases in this country that we thought we had basically eradicated, and now there's things that are popping up.
Well, this vaccination would be measles, mumps, rubella, MMR.
It would be MMR
that they're not getting. So
decades it has been used. Decades. Sure. Maybe concerned about its effectiveness or how it would work. So just really talk to your doctor, and if you are skeptical, make your decision on facts, not emotion.
Okay. Bottom of the hour, time for the news. Listening to Brad White and Paul White talking this morning about pharmacy issues.
Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture out, available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician in pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory.
Every month in each of our pharmacies, you can get your A1C lipid profile, which includes your cholesterol levels as well as glucose results, while you wait. A Medicine Center pharmacist will draw your blood and
brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun commission a piece of art to cherish for years. All at Studio Arts and Glass.
starting Monday 11 through Monday, February 18, Call pharmacist Paul White. Today, Brad and I are talking about the latest in
Prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit MedShopRx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing medication recalls, what you can expect from your local pharmacy, our local pharmacy, and some of the reasons why prescription costs are so high. So let's get back to the last segment of the show. But you know what? We would like you to vote for us and the best of the best pharmacy category with the repository. So you can do that online, and we would appreciate that. Thank you.
Okay, we want to kind of sum things up here today. We've talked a little bit about medication costs, and one of the things you can do to keep your medication costs down, or to be wise about how you choose to spend your healthcare dollar. Your doctor in good faith is going to give you a therapy to help meet your need based on their experience and education, and sometimes those prescriptions can be brand name and be really expensive, and they're the only option for you. But other times there are therapeutic alternatives which could be available generically, which can save you some money. So we can help you work through those options to find you an affordable method if cost is a barrier, because sometimes cost can be expensive. One of the great features we have at the Medicine Center is if you have a newer brand name medication therapy, there is often a manufacturer copay coupon card that can be helpful. We can do a search for you at no charge and look to see if that would be applicable in your situation with your insurance coverage. Or we can work with your doctor to help find you a therapy that you can afford and benefit from still. So don't be afraid to ask those questions about affordable medications. And it also is going to help you, believe it or not, the more affordable therapies that you're on is going to help you and your family and your employer and your employee colleagues' health plan premiums. So sometimes the most expensive therapy isn't always the best for everyone. We're kind of all in this together to control healthcare costs, so be mindful that your choices also impact the premiums of other people in your employer group, okay?
What about Medicare help and choosing a proper Medicare?
Yes, I'd be remiss. If your birthday's in February, happy birthday. If you are going to be newly Medicare eligible at the Medicine Center, we have the opportunity where we can do a free evaluation of all the medications you're taking and help you choose a Medicare Part D plan that is tailored to the medications you take. There are, I believe, 27 plans available in the state of Ohio this year. But you know what? Not every plan covers every drug. So we can help you find the one that is the premium fit and the copay fit and the formulary fit for your needs.
Okay. How about 2 questions about genetic testing? Does insurance cover it?
Insurance coverage is hit or miss right now. There are certain diagnoses that you can benefit from. If you have had a heart attack or a heart cath or a stroke, you may qualify for genetic testing to evaluate the blood thinning aspects of your medication. It's something that we can attempt. We do offer the test at cash, regardless of insurance. The price is $399. We can help you look into insurance billing, but at this time, I feel that it's kind of hit or miss. Some insurances are covering it based on certain diagnoses, and some are excluding it based as an elective option.
The pharmacist involved in consulting this interpretation of this test?
Yeah, one of the benefits you get from the test, you get the genetic profile, and then we'll sit down with you and go over all of the medication classes and how your body is affected by each one and how to interpret the results, and then we share them with your doctor and give them the benefit also of what the results are for you. So the whole package, you probably get about 45 minutes with a pharmacist, and you get your genetic DNA profile. Quickly, if you didn't hear in the beginning, our free diabetes kits are a gift for newly diagnosed patients of diabetes and new patients for diabetes services at the Medicine Center Pharmacy. So ask us about the Easy Max. Empower yourself with affordable diabetes testing. And don't forget that if you're trying to manage some medications, our strip packaging can be convenient and affordable and effective to take with you or manage your daily doses of medication. You don't need Amazon.com to manage your medications. The Medicine Center Pharmacy can do it here in Ohio for you.
Okay.
It's true.
Yeah, I know. Okay. All right. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, Kiko Auctioneers and Realtors, and, of course, our techno producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy, caring for you and about you. Have a healthy week. We'll see you again right here on News Talk 1480 WHBC at 9 a.m.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.